municipality who has provided us with pages of names of people who have not received services and who have been waiting days for those services. I'm receiving calls to my office, and I'm going to evacuation sites and hearing from people directly about the impact of this wildfire evacuation on them and whether they have access to services. We are hearing that northern residents are not feeling heard. From what we hear from their perspective, as people who have been displaced from their home communities, some having lost everything but the clothes on their backs, they are seeking information and resources. Based on what we are hearing and sitting with evacuees who have been displaced, we believe that people will be better able to manage the situation when they understand that there is a plan in place and what that plan is and how it affects them. So we emphasize good communication to all of those evacuees who are strung out throughout the province. Wayne, are you late again?
Well, I just got the assignment at about 1:45, so we need to.
I will give you a minute.
No, you keep on. I'll just plug it back here. Of course, parking downtown is impossible.
It's not a jury verdict, Wayne.
Yeah, I know.
We emphasize that good communication is key at this time to all those evacuations sitting in various sites across the province. Our knowledge keeper, James Pratt, has also emphasized the importance of family connections at this time to reduce stress. The worries that I have heard from the people that I've sat alongside, who come from communities like Creighton, Danair Beach, Woodlawn, both sides of the border, their worries are, what does this mean for me in the short term, the medium term, and the long term? And in the absence of responses, there are people who feel abandoned. My goal is to get their voices heard. As a legislative officer, my goal is to focus on solutions, not blame. We have a list of solutions that are needed right now, immediately, based on what we're hearing from northern residents and other people who are reaching out to me. The solutions involve immediate responses and resources, and at least some information of the long-term solutions, even if they are not perfectly known at this time. People want to know what is going to happen to them. Are they going to have a place to live in the future? Are they going to have a community? Are they going to have a job? Our goal is improvement in the response, not admonishment. The needs of those impacted must be met in order to have the best possible outcomes from the situation. The health and safety of individuals in the north depends on it. There can be no further delay in providing resources to all evacuees from the north. I'm also announcing today that our office will be conducting a systemic investigation in terms of the response to the forest fires and the evacuation and services provided. The scope of that investigation is not yet determined, but that is not what the focus needs to be right now. I need to take that off people's worries. That will happen later. Let's worry about the immediate. I want to reassure people that there will be a review by my office later on, but the focus right now is on immediate needs. The immediate needs are basic. They are to find everyone who has been displaced from their home a place to sleep and access to food. These are basic human needs, and the province is responsible for providing for them without any further delay. I have a complaint in my office about people sleeping in their cars, people who are hungry, people who are getting sick. They need an immediate response. The government's processes must also respect the need for dignity of each individual affected by the wildfire. The responses must be trauma-informed and responsive, as everyone who has been displaced has experienced trauma. We don't want that exacerbated further because we do not want further traumatization to occur. The ultimate goal of my office is to protect, defend, and promote justice and equity for all of the evacuees who have been displaced from their homes and their communities and their families. This includes fostering transparency, accountability, and good governance. So here's the message that I'm hearing loud and clear from the people of the North who are reaching out to me and who are joining us today. Government, your processes to provide services to those people who have been displaced from their homes in northern Saskatchewan are not working for many of them. Giving a response to an inquiry from a displaced person, that the response is usually provided in 24 hours when the person is driving in his truck around Saskatchewan and doesn't know where he's going to sleep at night, is not a sufficient response. A response that they will get back to you in 4 days is not a trauma-informed response. When the evacuees world, when the people of northern Saskatchewan, when their world is totally collapsed around them, they need an immediate response. The delays in response and access to services to meet basic needs, a safe place to sleep, and food, has fueled distress. People are confused, frustrated, and overwhelmed by a lack of information on how to access services. The information has been inconsistent or hard to get. I've worked 2 nights with my people on our 24/7 line to try to get a home and food for a person who is displaced, who's an employee of the government of Saskatchewan. It took 2 days to get them into the house. Some evacuees have been turned away from resources because they are residents from another province. There can be no provincial boundaries during a crisis, like an evacuation caused by a wildfire. Some people are being told that if they are from Saskatchewan but land in Manitoba as a result of an evacuation, that they have to return to Saskatchewan to access resources. One person who was accessing resources in Manitoba for a couple of days, he had a place to sleep and he had food, was told once they learned that he was from Saskatchewan that he had to return to Saskatchewan to continue to get a bed and to continue to get fed. People who are vulnerable because they've experienced the trauma, the displacement from their homes, should not be expected to travel long distances to access services. In addition to the load that that puts on them from an emotional perspective, traveling alone in the night again, they don't have the financial resources to pay for the gas that's required. So they have to make difficult choices about how they're going to spend the last dollars. Words that should not be used right now by any government or public entity. We are working on it. The time for working on it has passed, and immediate response is required. We will get back in 4 days is not a response that should be given, but it still is. The needs are immediate, and the response must be immediate. I'm calling on the government of Saskatchewan to do the following. Number 1, immediately put in place 24-hour services to clear off the long list of people who are needing a safe place to sleep and access to food. My office has been running a 24/7 service for firefighters and fire crews to be able to call us and immediately reach a person. I have 30 people in my office. I have 30 people in my office, and they have been doing that. Number 2, ensure that the 24-hour service is properly staffed so that there are no errors due to exhaustion. Phone numbers that we provide need to be accurately dialed so the person on the other end can be reached. So we can't keep providing numbers. We need to know that that number is being accurately recorded. But those people who are manning the 1855 number for government need a break. They need relief. But those lines need to be running 24/7, just like our line is. Provide information to evacuees that is accessible and understandable for people who have suffered trauma of evacuation from their homes in the middle of the night. And the messages have to be simple. It can't be a flood of emails and press releases. It has to be a simple message because they can't even process the information unless it is. Number 4, provide a response on the 855 number that is an immediate response. To be effective in a crisis, responses must be immediate at the very least at this point in time. Some people have been waiting 8-9 days. Use discretion in terms of the payments that are being made. I've been hearing complaints that there's inconsistencies so that people who have have been evacuated on Monday are only receiving payments on the day that they apply. So it's not retroactive to the day they've been evacuated. Provide critical incident debriefings within 2 hours of total losses of communities like Denair Beach for both the firefighters and fire crews, and to the residents who lost everything. Number 7, have one list of all evacuation sites with information on which communities have been sent where, so loved ones and family members know where their family members are. We have a partial list in terms of the hotels, but we've asked for that information. Provide access to phone services for evacuation sites so people can connect with their loved ones. One evacuee yesterday used our cell phone, to connect with a family member. There should be seamless services and equitable services. It shouldn't matter where you've been evacuated to in terms of the services you're receiving. There should be one database of all evacuees, whether or not they are at an SPSA or a Red Cross evacuation site. This allows people at other locations to also register, so there's one central record of where everyone who evacuates is. If the government has that list, if they could so kindly share it to the community workers so they can reunify families. I'm hearing directly from people that they don't know where their families are. They don't know where they've been evacuated to, and nobody can tell them. Number 10, ensure that there is a space for the doctors who have been evacuated from L'Orange to see their patients. I asked for this yesterday, so it may have been taken care of, but I've received no communication or confirmation. It's really important in times like this to have good communication. Ensure that those doctors who have been so open to finding their patients and providing support have the administrative support that they need to be able to function. People who have medical appointments that can't be missed or rescheduled are wondering how they're supposed to get to them from the community they've been evacuated to. Provide information so that people know how and when and where they go to access that service. Number 11, provide information to all evacuees today on how they can transfer or access their prescriptions so they can stay healthy. It can't be that we are working on that. Number 12, provide activities for both children and adults at all evacuation sites. Activities are super important for kids right now because it calms their parents. An anxious parent makes an anxious kid. So we need everybody to be calm right now. I think we have a joke downstairs with our security guard because our team has been to the Dollarama store so many times when we get a call out for coloring books or crayons that he says, oh, must be time for another Dollarama run. And that's what we're doing. That's what we're being asked to do. That's not our mandate, but we're certainly doing it when we get a call. Number 14, provide information on the long-term plan for rehousing those who have lost their homes. I've sat with people who have these questions. First of all, they will say, what day is it? And I'm like, I don't know anymore. I don't know anymore either. And the other question they will ask is, what is going to happen to me? Where will I live? Does the government have an answer or response that will reassure? It doesn't have to be a perfect answer, but it has to be something, and it has to be information. Number 15, in the absence of funding from government and access to the resources, some have turned to their insurance. But the problem that I'm hearing there is there are time limits on the insurance coverage, and the individuals from the north have to pay a deductible, and their premium will go up. They can't afford the deductible, but thankfully, some insurance companies have kindly deferred the payment of the deductible, but the residents who have relied on their insurance don't know what's going to happen when they are required to pay the deductible or when their premium goes up. Will the government provide reimbursement for those people whose payments were delayed? big question for many who've lost their homes is, what does the future look like? And we need hope. What is the plan, even if it is not yet perfectly formed? Who can they talk to in government? Who is the person that's responsible for talking to them about that? There are lovely workers at the evacuation site that I attended yesterday, and I'm going to give a shout out to them because I know they're going to be watching. But who is checking on the workers at the evacuation site? Who's making sure their mental health is good? It's a heavy, heavy load being at those evacuation sites. I want to give some shout outs to people that have come alongside our office to help us support others. The mayors and chief cooksters from the tri-communities have been absolutely amazing. Mayor Bashchuk and I are in regular communication. SaskTel came alongside us, and when the 1-800 toll-free number was requested that we man 24/7 for firefighters and fire crew, SaskTel did the impossible because they needed to, and they set up a toll-free line for us within 24 hours, not 72, so that firefighters could have immediate access at all hours of the day, and not just firefighters, but the fire crews, particularly those who have been at Denera Beach. I spent almost 5 hours yesterday with people from locations that had been total losses and heard their stories. My team has been hearing stories from firefighters and other members of fire crews on our 24/7 line. What our office is focused on at this time is everything we can do, which is 3 things. We are ensuring that any call from a firefighter or member of a fire crew is immediately answered. This includes municipal forces. Municipalities are under the jurisdiction of the Ombudsman as well. So I've sent messaging to all the municipalities that their fire crews can call us as well. While I don't have the capacity with 30 employees to run 2 24-hour toll lines, I'm personally monitoring all calls coming into our main message location at night and outside of regular business hours. This is to ensure that those evacuees who have basic needs, fed for the night, and access to food are responded to. The third thing we are doing is now starting to visit all evacuation sites to talk to evacuees and see what they need to come alongside municipalities and share our resources on trauma-informed and trauma-responsive care. We are providing self-care resources for everybody that we come across and having conversations, because what some of them need is just to be able to talk to somebody. They just need to be heard and tell their story. That is what our office is doing at this time.
We'll take a pause.
Sharon, just so you have pages of people. How many are you in contact with? How many are struggling right now to get services?
I don't even have time to count them. I tried to the other night, but I was too tired to count them. But I have a mayor who's writing by hand the names of each person who contacts her.
I guess just overall, how would you characterize the response the government's handling of this, of the evacuations?
So I don't have a particular characterization because I've indicated I will be doing a systemic review, and so I can't prejudge. And so what I would say is that what I'm focused on are the concerns that I'm hearing and asking that they be addressed. So I've given the list that I was provided to SPSA yesterday and asked for a response yesterday so that I could tell people something. I did get a response at the end of the day, but I don't know if any of those people from the response actually received any services.
What would you say your is the most concern you've heard from evacuees? Like what one is kind of most worrying to you?
I don't have a place to sleep tonight. I don't have food. My baby doesn't have diapers.
For the man who went to Manitoba and then was sent back to Saskatchewan, in terms of that, are you hoping to see more from Manitoba's provincial governments as well?
I don't have a mandate in relation to Manitoba, but I am in regular contact with the Ombudsman for Manitoba, and we are sharing information. And after this news conference, I will debrief with her. So we're providing support to each other. I have no idea. I have an important member of our resources who is located in Flint, Manitoba, and I'm in regular contact with them. But I have no opinion to offer in relation to the Manitoba government because it's not my business.
Yes, can you explain, like, how rare is it for your office to comment on an ongoing event? Normally, we hear from your office after an investigation has occurred. So, how can you provide some context to us on you coming out and saying this today?
Well, I'm being a megaphone, if that's what you're asking, and I'm amplifying the voices of Northern Saskatchewan, and I would think that's quite rare. But I'll defer to Leela, who has more institutional knowledge than I have of historically how rare it is.
And how are you feeling getting all these calls? Oh, are we do that first? Sorry.
It's very rare. It does happen at times. Like you say, usually the office looks at that event in the past and evaluates and things like that. And sometimes, though, we do see what's happening in the moment and there's an opportunity.
Can you speak into the mic?
All right, can you start over? Okay. So, yes, I've been with the office for a while, and I do know that most of the time, as you say, the office looks at events in the past, evaluates government response and government action, and then comments on it afterwards, which Sharon has indicated we do intend to do. It is more uncommon for us to comment on something in the moment. At this time, as she has expressed, we feel it's important to state what we see at this time without prejudging.
You also mentioned some gaps in communication in the response. In your opinion, who's responsible for filling in the gaps?
Because I've announced that I will be doing an investigation, I won't prejudge because that would not be procedurally fair. I have asked for a point of contact so that I could problem solve and collaborate with somebody. I have a person, but I basically am getting updates from them saying, I'll get back to you, I'll get back to you, I'll get back to you. People have been waiting a long time for that getting back.
What are your thoughts and feelings when you get that call and you're on the phone with these evacuees not getting the supports they need?
It's not about me, it's about them. So what are they feeling? They're feeling abandoned. They're feeling sometimes hopeless. They're feeling angry and frustrated, and they want answers. But you know what? People of the North are pretty dang resilient and they're pretty fierce. So they have a lot of local community individuals who are stepping forward and they're triaging for me. They're combing through Facebook sites, they're talking to people in the community, and they're sending me tombstone information so we can follow up. And that's something they're doing. So I have a social worker doing that. I have a community worker doing that. And anybody else who wants to do it, it's fine because they're feeding it into our system because they're all coming alongside each other to help each other because that's what they do in the North.
Would you say that it's an unprecedented situation for your office to deal with this situation right now?
It's an unprecedented situation for us to be asked by SPSA to run a 24/7 phone service for firefighters and fire crews, but we've said yes to it. It's unprecedented for us to have evacuees reaching out saying that they're not getting food, that they're not having a place to stay. It's unprecedented for us not to have a more responsive response when we say we've got a problem and people need to be fed and need a place to stay. That's unprecedented, yeah.
Just on the pages again, are we talking hundreds of people?
There's a discrepancy that I haven't reconciled yet, because I was told originally it's 13 pages, but I got 9 pages, and then there's more pages, and I haven't even had a chance to look at them. So what we're trying to do is get them all into our database, because when they get entered into our database, then we can sort it. And so this any complaints that come in relating to anybody affected or impacted by the wildfires, we have up Northern Lights. So then I'll be able to search and find, here's all the Northern Lights files. But I don't even have the ability to do that at this point because I'm responding to people's needs.
You mentioned the 24-hour line is operating. Is there kind of a timeline for how long you'll continue operating that line, or is that just indefinitely continuing while this is,
And we'll operate it as long as my people are psychologically safe and healthy and able to do it. I'm very lucky that I have a very passionate group of dedicated people who are honored to be able to run that line and who are helping each other out and supporting each other. Most often they're telling me to get more sleep. So they're wrapping around each other to help each other through the situation. And so the impact doesn't end, the trauma doesn't end when the fires are done. You know, people going back to their community. That's actually when the hard work begins. So I have thought about, well, what do we do? Because we're not just going to drop off and abandon, but we have to triage them off to a different service. So some of them are getting referrals. I don't really want to say much more about what I'm doing with them because it's their privacy and I really want them to be comfortable calling us. And so I don't want to say anything about what the content of the calls are. But I would say it's incredibly important that we're running the line right now. And I won't just drop them off at the end, but I'll make sure they transition to another service that can actually provide the care they'll need when everything. People think when everything's done, when the fire's out, that's great. People go back to their communities. But that doesn't erase the memories of what happened. Right?
I know you're doing your investigation, but like people not being able to get services, like what are the main gaps there where they're not getting it?
I'm not getting answers to be able to actually answer that. Usually I am able to ask questions and get answers to why is it taking 4 days to respond. But I'll give you an example. I followed the direction we were given and recorded methodically what happened when we followed the process we were sent to. So we called actually, because we like people to self-help and we can't make all the calls for people given the volume. We referred a person to the number and said, could you call the number and then call us? It was middle of the night, right? That one was started middle of the night and then ended up next day. They called the number on the second day, I think we referred to it, and they were told that, this is morning on the second day, and they're looking for a place for that night to stay and food. So they were told that they would, the person that answered the 1-855 number couldn't help them, but they had to be referred to a specialist, something or other, another group. And so the person seeking the services said, and how long will that take? When will I know, right? Because he wants to know where I'm sleeping today. They said it usually takes no more than 24 hours. So I said to my fellow who was on the 24/7 line, I pulled him off the firefighter line, like he's watching it, and I'm pulling him off of it and saying, can you call the 1-855 number and ask the same questions? He called and asked the same questions and was told within 24 hours, or usually within 24 hours. And he went further and said, okay, can I talk to somebody at the specialist group? And he was told, no, I don't even have that number. So there's not much more we can do if we're told we can't have access to the official providing the service, which is very unusual for our office, not being able to ask. And that's about transparency, right? Now, it may well be that that person is so busy that they don't have the ability to, but where does that leave people who are trying to get their source?
What are you hearing about, I guess, payments, financial assistance? Is it direct deposit? People are saying they're getting grocery gift cards instead. What's actually happening?
There's a wide range of different situations happening, so I can't give you usually I would know, so as an ombudsman, I ask what's the process, right? And then somebody tells me and I'm like, okay, now I can measure your behavior and against the expectations, right? And against the legal authority or whatever the program guidelines. I don't know.
I know you had mentioned that there's a list of recommendations that you're making right now for immediate action. Having covered fires in Alberta last year, the common mantra seems to be, we should have known better, we should have been ahead of this. So obviously the focus is right now, but what would be some of your recommendations to prevent this happening from the future? Or are you waiting for your internal investigation before you make those recommendations?
To be administratively fair, as a statutory decision maker, I can't prejudge or make recommendations without hearing from both sides and doing a review. The only reason I've said I'm going to do a systemic is because I know people need to know that, and I want to take it off the table so they can focus on other issues that are more immediate.
When you say systemic review, can you just maybe explain what exactly that will look like for your office or what that means?
Yeah. The definition of the scope, it will depend on what we learn as we go along. So for example, and I'm not saying this is exactly what it would be, but to answer your question, Alex, is it could focus on, for example, payments to serve our provision of services to individuals. And you can make that broader or narrow depending on. So that is an immediate issue that is in my mind, top of mind for me. But I will not prejudge until we get to a later point and then consider it at that point. Because scoping of an investigation is always something you have to consider.
How would you describe the situation or the response here from Saskatchewan compared to other provinces?
Well, I really haven't done an analysis because I haven't had time to do that. But I could refer you to the BC Ombudsperson has written a report from the 2021 fires in BC. And so that is a 100-page-ish report, which will provide an answer to that question, at least as it relates to BC. I'm just going to check online because we have the Northern reporters online.
It advised that they could follow up with us.
Oh,
So we'll take their one.
I'm going to take a break then. All right, thank you for coming.
Thank you.
Never change.
Yeah.
Yeah.